Here is your first term.
Okay. Okay, next one. Okay, the next one.
Okay, so if you've read and understood, considering it communication skill station, please begin.
Okay, hi, good morning.
Good morning.
My name is Dr. Alam Al-Huda, CET1, working for Mr. Mann in the Royal Hospital. Call to speak to Mr. Robert, who is a trauma head consultant, to update him about trauma patient. Can I confirm that I'm speaking to Mr. Robert, trauma head?
Yes, speaking. Please summarize your case.
Yes, thank you for your time. I have a young boy involved in the motorbike RTA and brought to the emergency department. Vitally, the patient have GCS 15 out of 15 on arrival and hemodynamically stable. On examination, there is a right abrasion in the left flank, and there is abdominal distension and tenderness. And the patient have fractured left leg, open fracture of the tibia and fibula. On investigation, the blood investigation of the patient is normal, except trace of the C-reactive protein. The X-ray of the patient, there is a fracture of hand metacarpopharyngeal joint, and there is open fracture of the tibia and fibula of the left leg. And chest X-ray is normal. Ultrasound reveals there is a paracolic gutter fluid collection. The nurse called me because the patient have his leg become pale and cold, and there is no pulse. So the patient developed worsening pain. So I'm suspecting the patient have acute limb ischemia. So that I want calling you.
All right. So what is your plan of management for this patient?
Okay. First of all, I will start the fluid resuscitation and give the patient antibiotics, anti-tetanus, and then after that, I will call for the orthopedic consultant and the vascular consultant. And then after that, I will do the CT brain and head, and then I will do CT abdomen and pelvis.
All right. And?
Then we can give the patient analgesia, and antibiotics, and
Okay.
we can reduction the fracture and immobilize the fracture.
How are you going to fix the fracture?
As it is an open fracture, I will gonna to fix the fracture by the external fixation.
All right. Okay. Before sending the patient to operation theater, what are you going to make sure?
Okay, I will make sure that the patient is given the fluids and analgesia as well, antibiotic, anti-tetanus, and the fracture is immobilized, and make sure that the vital signs of the patient is stable.
Okay, that and the tractions for the fracture has been
Yes,
placed.
traction.
And what about the investigations? When these blood investigations were done, and when are you going to repeat the blood labs?
Okay, I will repeat the blood labs, which is a complete blood count, the blood grouping and cross matching, renal function test and liver function test. After before the sending of the patient.
Okay. And what about the wound of the patient? What are you going to do for the wound?
Okay, we're going to debride the wound to remove the necrotic tissue. Then we can debride the wound in the theater after in the 24-hour from the time of the trauma or injury, and to make sure that decrease the risk of infections.
Doctor, can you confirm if your patient is wearing a C-collar?
I'm not sure for this information, but I will check it and update you.
Okay, why are you calling me right now? Isn't it that possible that you can wait overnight?
Because the patient have open fracture of the left tibia and fibula, and he has a vascular injury, so he need an urgent operation to avoid the ischemia and compartment syndrome and to save the limb of the patient.
Are you sure if your patient is dehydrated or is it hydrated enough?
I'm not sure for this information as well, but I will check and I will update you.
Okay, and why are you going to ask for general surgeon? If you say abdomen feels normal.
Yes, because on examination, I noticed that patient have abrasion in the left colic and the left side of the abdomen. So we suspecting the patient may have a splenic injury. So we need the general surgeon to deal with this. And also in the ultrasound, she said that the patient have a paracolic fluid collection. So the patient may need laparotomy. And also the patient have a wound at the side of the open fracture. So we need the general surgeon to deal with this wound and the risk of compartment syndrome as well.
Okay, and right, you said, okay, patient is developing cold and pulseless extremity. What is your plan to manage that?
Okay, as a patient have developed pulseless leg, so we urgent call the vascular surgeon to save the limb of the patient. And before that, we're going to resuscitate the patient and then send the patient.
No, and which investigation would you do before you'll?
Okay, investigation, yes. I will do the duplex ultrasound, and if the time is allowed, I will do the CT angiography.
Of the lower limb. Okay. All right. Before sending the patient to the operation theater, who are you going to inform?
Okay, I will inform and involve the anesthesiologist and the orthopedic consultant and the vascular surgeon to deal with the vascular injury, and the neurosurgeon if there is injury to the nerves. And I will also need to involve the general surgeon and the plastic surgeon.
Okay, and how are you going to take care of the free fluid in the abdomen of the patient?
Okay, after saving the limb of the patient, we can contact with the general surgeon to do the expiratory laparotomy.
Good. Right. Why? All right. There are at least 3 things for which you need general surgeon. Can you quickly tell me?
Yes, the risk of compartment syndrome, and to deal with the wound at the site of open fracture, and to deal with the interabdominal collection.
Okay, and why would you ask for the plastic surgeons?
Because the patient have open fracture, so he may need a soft tissue reconstruction like flap or graft.
Okay, good. Thank you. So you can send over the patient.
Sounds.
Thank you.